Hi there, so we're here again as we do every time we put out a new tablet issue of the Medical Post to do a little video talking about the issues in that issue. I'm Colin Leslie, Editor-in-Chief.
And I'm Tristan Bronca, the staff writer.
Wonderful. So our first topic that we have is doctors and social media.
So obviously there are a lot more doctors on social media now. I'm just wondering if you can speak a little bit about how that's having an impact on how doctors are exchanging information.
Yeah, so basically what I want to do for my editorial is we've got a physician advisory board, and I sent a note out to them asking them about how social media impacts them. And a lot of them had things to say that it's, good for exchanging information and promoting best health practices. But they also said there's been a bit of a downside, that we're seeing a little bit more of non-evidence-based treatment advocacy happening, in that patients are talking about issues. There's the chronic venous insufficiency in MS, chronic Lyme disease. These things really patients talked about, and sometimes the evidence is weak. But those opinions are amplified among social media, and doctors find they're dealing with that in a way they didn't used to as much.
Mm-hmm. And so doctors are obviously dealing with patients. What about amongst colleagues? Have you noticed any kind of change in the way, physicians are interacting with one another?
Yeah, for sure. I mean, some of the people that I asked, the doctor said, that it used to take a long time to even just get a little quick second consult, but they can use Telederm and e-consult and get a little bit of information from another doctor rather than trying to phone call and that kind of issue. And certainly, we have a person who just graduated from, just got their medical degree among our advisory board members, and he talked about the fact that medical students are very cautious about how they're seen on social media. They get a lot of messaging about that because they're concerned as they go through CARMS, which is the match where they get selected for their residency program, that that they won't get a match if they're not presented right on social media. He said he was at an event where one medical student, it was some kind of function, and she didn't want a photographer to take a picture of her with a drink in her hand because she thought that might ruin her chances to get the residency spot she wants, which is very competitive.
Yeah, super careful. Which is funny because when you look at comment sections and most of what you see, I think, on Twitter and Facebook, caution seems to be less evident.
Yeah.
I mean, people tend to be meaner and they tend to be saying exactly what's on their mind. I'm just wondering if doctors are any exception.
Yeah, I think so. I mean, certainly some people said it's really being hit, in terms of, I think someone said that they had professionalism lectures from the faculty members, and several of the doctors, even who've been practicing for a while, said that's something they think about. But, one of the physician advisory board members, Dr. Sean Watley, is also a blogger, and he just feels like, this is must have been what it was like when you first had the printing press, that these kind of opinions are going out. He blogs, he sees the board members that he's on being influenced by what they hear, so, there's a real upside for that around that.
So I know one of the other things that you mentioned in your editorial was that the medium is obviously evolving, or all of these mediums are evolving, and now you take something like Twitter, it's not the same as it is today as it was a few years ago, and you mentioned that in 3 years' time might be something totally different.
Yeah.
Where do you see it going? You mentioned, I think, that you see it possibly getting meaner, but I mean, there's obviously potential for good here too, so I'm just wondering where we're going to see ourselves in a few years.
Yeah, I don't know. I mean, that wasn't really so much what I got from my advisory board. It was my own theories a little bit, that social media is, they're creatures of human beings, so they're going to change over time. Mm-hmm. And I just think that's kind of an interesting concept. Mm-hmm. But we'll definitely see where we go.
Sure.
So our next topic was the Patients First Act, What Now? So this is Ontario Bill 210, and you in fact wrote a significant story for the magazine about, and then in Ontario here we had news that a tentative fee deal had been reached between the province and doctors, so we pulled that coverage out and stuck some new coverage in. Yep. So tell us a little bit, what was the Patients First bill supposed to do?
Sure. So we had put together a 2,000-word story basically on looking at this very controversial bill which proposed to give the local health integration networks power of oversight, I guess, over certain doctors and other healthcare providers. And doctors weren't happy about that at all. But what I think they were most unhappy about was the fact that this very controversial legislation had been put together without any real input from them. The OMA said that, this was something that the ministry had basically dropped by to just say, this is what we're doing, and any any prospect of, I guess, collaboration was really shot down. So, but then what happened is like July 11th, I think it was, they came out with their tentative agreement.
Yeah.
That sort of came out of the blue, and they mentioned that Bill 210 they're going to be looking at again, and now they've agreed to work together on it. And specifically, they're looking at two specific sections of the bill that are either going to be taken out or revised, and those two sections are the ones that, as far as I can tell, doctors were most concerned about, and those have to do with reporting to the LHINs. So under the original legislation, doctors would have been forced to let the LHINs know if they're going on vacation, for example, if there are any significant staffing changes, retirement, and they didn't like that. And the other section that is being looked at again, it has to do with the LHINs basically being an extension of the minister when it comes to making changes within the system. So those two sections are being looked at, but how they're going to change exactly, or whether they're going to be taking out is still up in the air, it seems.
Mm-hmm. And I think even, circling back to social media a bit, this was one of those things where there's all sorts of things doctors saying, in terms of how much control they thought that the government was going to have over their practices that was swirling around. Did you find people were overestimating how much the government controlled, or was this a genuine threat to physician autonomy?
I don't really know about that. I mean, there were a few physicians. I remember we spoke to one physician who had worked with the government, and he had talked with members of the government, bringing up some of these concerns that other doctors would have. Like, you're going to be able to hire investigators to come into my practice and, sort of needle around and look through our patient files and that sort of thing. And he said that the ministry looked at him and said, no, that's not what it was supposed to be at all. But there was a great deal of ambiguity around all that, because a lot of doctors, even when we got in touch with the ministry and got them to clarify and basically say the same thing to us, that no, this isn't going to apply to doctors. A lot of the other doctors weren't at all convinced that they were going to be spared from these, really intrusive aspects of this legislation. Now, with the ministry and doctors ostensibly working together, it's unclear what's going to happen with those things. We do know, I think, that 210 is going to be in effect in some respect, but what exactly it's going to look like, I don't think anybody has a really good idea right now. So
it should be interesting for fall.
Yep.
I think that's it for us. You can always get our tablet edition from the website link there, or at least that's from our main website. Thanks so much.
Thanks.